All right, can you guys see that?
Looks great. Yeah.
Okay, so sorry for the technical difficulties. I'm Eugene Park. Mike gave a little bit of an introduction here. I'm here to talk a little bit about men's health. Specifically, I'm going to talk about erectile dysfunction. Have a little bit of a presentation here, so let me go ahead and get this started. So here's a bit of a link here. Are you guys seeing, do you guys see everything on my screen?
We just see the presentation.
Just, okay, perfect. So this is a link. This will give you guys some education on some of the products here. So if you guys want to take a picture of this, I think this is being recorded, so this will show up, but there's a QR code you guys can link to. So a little bit about me. I'm a urologist over at Urology Specialist in Sioux Falls. I work over in Sioux Falls, but I go out to Hendricks. I'm in Brookings for now. That's going to change a little bit. I'm at Marshall, Minnesota. I'm also in Ortonville. So we all do outreaches, and those are my outreaches. Eventually, it's just going to be Hendricks and Ortonville. I did my, hold on one second. Keep getting all these new screens popping up. I did my education at the University of Illinois. I did my internship, my surgical internship over at University of Nebraska, and my residency at University of Nebraska in Omaha, so UNMC. A little bit about me. I was born in a town called Rockford, Illinois. Do you guys see the software update screen? Is that showing up?
Yeah.
I don't have access to this mouse here. Give me one second. There we go. If I can move this to... Is that better?
Good now. Yep.
Okay. So I was born in a town called Rockford, Illinois. Rockford's famous for, I don't know if you guys remember the band Cheap Trick. They're from Rockford. The movie A League of Their Own was based on the Rockford Peaches. I always bring this up. This was on The Daily Show. Rockford voted Taco Bell as their #1 Mexican restaurant one year. So hobbies that I'm interested in. I didn't do this before. I thought that maybe people would be interested in knowing a little bit about me. I like traveling. I'm a Leo. I like fishing, photography, dogs, barbecue. Thought I'd show a couple pictures here. This is some of the barbecue that I do. This is a little bit of the photography I'm doing. I'm a bit of an amateur photographer. Fishing is relatively new to me. I've been doing a lot of fly fishing lately, but I do like to do regular fishing for bass and things like that. And I am a little bit of a dog hoarder. I've got 4 dogs, and you can kind of see them in various stages here. All right, so learning about erectile dysfunction. What is it? How common is it? So what is erectile dysfunction? We define it as the inability to achieve or maintain an erection firm enough to have sexual intercourse. How common is it? It happens in about 1 in 5 American men 20 years or older, or about 1 in 5 men experience it in their lifetime. More than half of men over the age of 40 have some degree of ED. It affects approximately 39 million American men. So common thing, a lot of men have it. If you do have it, don't feel like you're alone. The erectile process. So once a person gets aroused, the nerves around the penis become activated. Muscles relax around the blood vessels, which allow blood to flow into the penis. The addition of blood causes the penis to stiffen. The internal tissues of the penis is basically like a sponge. And so the addition of the blood causes the penis to stiffen. The erection compresses the veins so the blood can't leave the penis, enabling the penis to remain erect. So basically, it's a blood flow phenomenon. It's a picture of the flaccid penis, and you can see a picture of the engorged penis. So causes of ED. Top 3 physical causes are vascular issues, diabetic issues, and medications. ED can be the result of prostate cancer treatment. That's something that we see specifically as urologists, because when we treat prostate cancer, sometimes the nerves that control sexual function get affected. Sometimes ED can be a precursor to, or it can be a sign that you may be getting something like diabetes, heart disease, or vascular disease. ED in general can have a broad negative impact on health-related quality of life. So erectile dysfunction and diabetes, this is a big one. According to 2015 census data, 15.3 million men in the US have diabetes. The thing about diabetes is that it's a disease of blood vessels and nerves. And so patients with diabetes and ED are less responsive to oral treatments for their ED, like Cialis or Viagra. In men with diabetes, ED is more severe and associated with a decreased quality of life. I can't see that last part of the slide here. Oh yeah, it's just saying that in some people, ED can be a precursor to actually having diabetes. So the reason why ED can emerge, 60 to 70 people, 67% of people with diabetes have nerve damage or neuropathy. If you know anyone with diabetes, sometimes they'll talk about having numbness in their hands and feet. It's the reason why they have to watch their feet carefully. They can't sometimes notice when they have injuries to their feet. And if they're not careful, they can get infections. Diabetes accelerates damage to the inner lining of small arteries. And that's important too, because if you know anyone who's diabetic, they're also at risk for things like heart disease. ED pills require stimulation, the nerves, and healthy blood vessels. If these are damaged due to diabetes, pills may not be as effective. Factors that may play into the diabetic process: advancing age, diabetes duration, poor glycemic control, vascular disease, diuretic treatment, heart disease. So erectile dysfunction and heart disease, the two are also related, like diabetes. Symptoms of heart disease may develop within 2 to 3 years of ED. So ED is actually an independent risk factor for future heart-related events. The severity of ED is correlated with the extent of coronary artery disease. And ED actually precedes coronary artery disease symptoms in almost 70% of cases. The reason this happens is because if you think about it, the arteries that supply erections are much smaller than the erections or the vessels that go to the heart. And so it makes sense that if there's going to be issues with things like plaque or cholesterol plaques or blockage, the smaller arteries will get affected first. So that's why sometimes erectile dysfunction can be a hallmark of coronary artery disease. This diagram just kind of shows you the diameters, different diameters of the blood vessels. This is just saying that at 50% obstruction, the penile artery may cause symptoms of erectile dysfunction. So in general, if you think about protecting your heart, if you think about the heart and the erectile function as being related to each other, if you do a heart healthy lifestyle, you'll actually be doing yourself a favor as far as sexual function. So things that will help: healthy diet, exercise, physical activity, weight loss. Smoking's a big one. A lot of people with smoking have vascular issues. So if you're a smoker, erectile dysfunction and smoking go hand in hand. Stress reduction is another thing that would help. Erectile dysfunction and prostate cancer treatment. So if you're seeing a urologist, if you have prostate cancer, at some point, you're probably going to have a discussion about erectile dysfunction. The nerves and some of the blood vessels that supply blood to the penis for an erection lie very close to the prostate and may be injured during prostate cancer treatment. So this diagram just kind of shows you the anatomy here. So I don't have a mouse to show you, but if you're looking on the right hand of the screen on the bladder, that's closer to the head of the patient. On the bottom where this says urethral sphincter, that's closer to the feet of the patient. This is kind of a side view. Those yellow structures there with the arrows to them, those are what we call the neurovascular bundles, and those have blood vessels and nerves that actually help regulate sexual function. So during a prostatectomy, or when we remove the prostate, there's always some degree of damage to them. We can often try to do something called a nerve sparing to try to spare the vessels in the nerve. But even when you do that, there's usually some compromise to the vessels and the nerves. The same is also true for radiation. Radiation will affect the area around the prostate as well, so there can be some damage. It just happens a little bit more slowly with radiation. So here, those arrows are kind of showing you where we make the cuts to do the removal of the prostate. These diagrams are showing you what it looks like when we do a nerve sparing procedure. So sexual dysfunction after a radical prostatectomy, it's pretty common. It actually affects about 25 to 75% of men. You'll see people quote studies about how they have super low rates of erectile dysfunction after surgery. I mean, the fact of the matter is it kind of depends on how you define sexual function really determines what your success rate is, quote unquote success rate. But the reality is it's pretty common for sexual dysfunction to occur after surgery. And here's a statistic saying that sexual dysfunction after radiation affects up to 50% of men. But again, that's usually years down the road because the changes that happen with radiation are a little bit slower than surgery. So treatment options for erectile dysfunction. We actually have several different ways to provide an erection. I think most people are pretty familiar with the idea of the oral medications. These days, the most common are going to be sildenafil or Viagra and Cialis or tadalafil. Both of those are generic these days, so they've become pretty common. There is something called injectable therapy. That's the second option here. We can actually give you the end result of what Viagra does by injecting directly into the body of the penis. It's actually a very effective way of doing it. It's got a pretty good success rate. You just have to be okay with the idea of giving yourself injections. The other thing that happens is as time goes on, you can develop scar tissue from all the poking of the needle into the body of the penis. There's something called a vacuum erection device. That's the third option here. This kind of takes advantage of the principle of drawing blood into the penis. You can create a chamber basically and draw blood into the penis and create yourself an erection. There's a picture of a band at the base of the penis. You have to use that band to keep the blood from going back into the system. It's another way of getting an erection. Some people like it, some people don't. One of the things that happens is that the blood eventually gets cool, and some people don't like that sensation. Some people don't like the lack of spontaneity with it. The next option is what we call urethral suppositories. I'll be honest, I don't give this one very often. It's the same medication that's used in the injection, but in my experience, I haven't had a great amount of success with using this one. I tend not to recommend this one. It's a little pellet that goes inside the urethra, the urine channel. And what happens is as it dissolves, it kind of gets into the tissues of the penis and causes the erection. Not a great option, in my opinion. The final option is the penile implant or the penile prosthetic. And that's the device that we can actually insert into the body to give you an erection. So that one's kind of the most aggressive option. I usually tell people that's the option to look at if we're really interested in getting function and the lesser options are no longer working. The oral medications, how do they work? How effective are they? Common side effects, some cautions. Almost half of some men with ED who try oral medications give up on the medications or they stop working. Men with diabetes are up to 2 times more likely to move on to other treatments. So the way it works is the oral medications eventually will lead to the process of creating the blood flow into the penis. And it's effective in about 60 to 80% of cases. Efficacy can be affected by food, especially sildenafil. You'll hear us asking you to take it on an empty stomach. Common side effects, headaches, facial flushing, upset stomach. Most people, if they stop the medication, it's because of a headache. They get this really bad headache, and it has to do with dilation of the the vessels that it does. You need to talk to your doctor if you're taking something called an alpha blocker for your prostate or for blood pressure, or if you take nitroglycerin or nitrates for your heart. If you take a nitrate because you have chest pain and you take these medications, it can drop your blood pressure dangerously. So those are the nitrates, especially, is something to tell your doctor about if you're thinking about doing the oral medications. The intracavernosal injections, or the injectable medications, basically it's like I said, it's a combination of medications. We use something called trimix, but there's different formulations of it. You use a small syringe and a small needle to inject the medicine directly into the penis, and what it does is it creates the same response that the oral medications do. But if you don't have good nerves, or if you had a surgery and the blood supply isn't there, you can give that medicine directly into the penis and get an effect. So how effective is it? Despite success rate, approximately 40% of men will discontinue the therapy, typically within 6 months. It's actually very effective, but some guys just don't like it. And it's, even when we show you how to do it, sometimes there's an issue with technique. And common side effects: penile pain. You always hear the commercials talk about erections lasting more than 4 hours when you hear about like Viagra and things like that. That's actually very rare with the oral medications, as long as you follow the directions. This medicine can give you that prolonged erection. We call it a priapism. And some guys think that that sounds great. It's not. What happens is after 4 hours, you can actually start getting permanent damage. You don't get fresh blood into the area, and the tissues start dying. And so it's a medicine that works, but you just have to be careful that you don't give too much of it. So you have to start at a very small dose, then you kind of have to, what we call titrate, or go up on the dose slowly until you get the desired result. Most common reasons for discontinuation: failed erections, pain, dislike of the injections. So the vacuum erection device, how does it work? How effective is it? Most common side effects, most common reason for discontinuation. So the pump, like I said, it draws blood into the penis, and you place that tension ring at the base to maintain the erection. How effective is it? Patient satisfaction rates range from 60 to 80%. It's like any skill, you got to learn how to do it properly, and there are ways to be more effective than others. Some people will take the time to learn how to do it properly, others won't. Some people just don't like the sensation. Most common side effects: blocked ejaculation, bruising, discomfort, pain, penile numbness, and we talked a little bit about the coldness. Most common reason for discontinuation: inability to achieve or maintain a full erection, pain or discomfort. The suppositories, I'll just go over this one briefly, but basically after urination, you insert the pellet into the urethra, the urine channel. There's a little picture of it. Success rates are reported at 40 to 66%. I'm not sure I would go that high, but common side effects: genital pain, minor urethral bleeding, spotting, low pressure, dizziness. Most common reasons for discontinuation: insufficient erections, urethral pain. It's just not, I just don't think it's a great product, but it is available, and some people do opt for it. So the penile implant, this is one that you typically go to see a urologist about, someone like me. And it's a very good device, and it's a way to give you sexual function. So how does it work? If you look at this diagram here, if you look in the testicular area, there is a pump that we hide in the scrotal area. That pump is connected to a reservoir. It's up kind of up top there. You can see a little ball of fluid. That pump will allow the cylinders that you see in the penis to inflate and deflate with fluid. There's a button on there that you place, or that you press to deflate the device. So it's basically a way to give yourself an erection and to take down the erection a little bit more in a physiologic fashion, or more natural fashion. So how effective is it? 98% of patients reported erections to be excellent or satisfactory. Most common side effect complications, there can be postoperative genital pain or infection. It's a foreign body, so it's like having a joint replaced. Any foreign body could get an infection. It is a mechanical device. The mechanical device can wear down over time. Any mechanical device can malfunction over time. But here it says at the 7-year mark, 94% are still fully working. There are different types of prosthetic devices. The one most people know about, I think, is the 3-piece inflatable device, which we just kind of described. It's on the left there. There is something called a 2-piece device. It doesn't have that reservoir. And there is something called a malleable penile implant. The malleable device is just a bendable rod that we place on the inside. So you are physically in charge of bending and straightening it, basically. There are benefits to the other 2 devices. I think they're less common, but the biggest thing is there's less hardware to get infected. So we might talk about making a decision. If you're at super high risk for infections, or if you have diabetes that's poorly controlled and we're worried about infections, sometimes we'll recommend not going for the full 3-piece device. But I think most people kind of want to go with the 3-piece device. I think it's a little bit more natural. I think it's a little bit more effective as far as function. This is talking a little bit about the device, the Boston Scientific device here. This specific device is coated with an antibiotic treatment, and it's designed to try to reduce the risk of infections. That's kind of the biggest concern that we all have when we do something like this, is that could this get infected? The antibiotic is designed to kind of diffuse into the tissues around once it's implanted, and it kind of creates a protective barrier while the device scars into place. It's been clinically proven to reduce the risk of infection. The device is designed to most closely mimic a natural erection. The device provides rigidity when inflated. If you ever come and talk to me, I usually will have a device to show you. I'll actually inflate it up pretty full, and I'll show you. I'll kind of pound it on the table to show you what kind of tensile strength there is to it. It does have a natural flaccid appearance when it's deflated, so that's another reason why some guys will opt for the inflatable prosthetic. Surprisingly, the implants have been in clinical use for over 45 years. Over 500,000 men have received an implant. People don't talk about it, obviously, but there's a lot of guys out there. You may know people who actually have the device. They just don't talk about it. The technology and the techniques have changed over the years, but yeah, this is a pretty solid technology. It's been around for fairly good amount of years. What to expect if you decide to do surgery. So this is typically done as an outpatient. You get to go home the same day. I will make a single incision to do the procedure. There's different ways of doing this. I do something called an infrapubic approach. So the incision is right kind of by the what we call the pubic bone, or the bone right on your pelvis, underneath your belly button. Through that one incision, I can do the whole thing, and we just close it up. Generally, it takes a few days to get back to regular activity. There's a lot of swelling and bruising that happens. I actually send everybody home with what's called a drain. There's a lot of fluid that collects in the area over the next 24 to 36 hours. And I'll typically send you home with a drain to get rid of that fluid. It's kind of a contained space, and if you get too much fluid in that area, it's kind of like when you get hit in the scrotal area and there's a lot of swelling. It's just super uncomfortable. So those drains will let that fluid come out. I will teach you guys how to start using the device in about 3 weeks. I'll start having you guys do some stretching exercises once we activate. But I've been having people hold off on sexual intercourse or using the device for 6 weeks. And mainly that's because I do split the muscles at the bottom of the abdominal muscles to get that reservoir, the fluid reservoir under the belly of those muscles. I just don't want things to tear and for something like a hernia to develop. Cost and coverage, everyone kind of talks about this. The devices are typically covered. This is not compared to like a breast implant surgery where that's considered cosmetic. Because this is an organ and the organ is not functioning, most places or most insurances will provide coverage for this. Insurance coverage obviously will depend on what insurance plan you have, but it is covered by Medicare Advantage. If you're interested and you want to talk about the finances of it, you can always let us know. We actually have people dedicated to talking to patients about these types of things, so we can look up your insurance and kind of go over options if this is something that you're really interested in. So benefits of the penile implant, 97% satisfaction, 98% partner satisfaction with the three-piece implant. The implant, because of the antibiotic coating, is clinically proven to reduce the risk of infection. It's affordable, typically covered by insurance and or Medicare. Long-lasting, permanent, and concealed solution. It's durable. 89% are still in use after about 10 years. The big selling point, I think, is the fact that it's a little bit more natural than some of the other options. Designed to maintain a natural appearance in the erect and flaccid state. It typically doesn't interfere with ejaculation or orgasm. It's spontaneous. You can have sex when the mood strikes. Risks of the procedure. And if you are interested in this, you ever come talk to me about it, I'll go over this in a little bit more detail. But anytime you do a surgery, even if you're having a mole removed, there's some risk involved in a procedure. And not all patients are candidates for a penile implant. You may have, this is an elective procedure. If we feel that you have too many medical issues that make this a safe procedure for you to go under, we may have to discuss that maybe you're not a great candidate for it. But we will go over the risks and benefits in detail. But some of the risks that involved in the penile implant, once you do the procedure, this is kind of a point of no return. Once you do the surgery, you can't go back to the oral medications. You can't go back to the injections. This is kind of a last resort type thing. If you're planning on doing a surgery, you should understand that this is kind of a point of no return. There can be mechanical failure of the implant, which may require revision of surgery. There can be pain associated with it. We talked a little bit about the bruising and the swelling. There can be pain as well. Men with diabetes, spinal cord injuries, open sores may have increased risk of infections. When we talk about the risk of infection, I think most people will quote that nationally, the risk of infection is about 2% across the United States. So 98% of the time things go fine, but anyone could potentially get an infection. So kind of sum things up, ED is a common problem. It may be associated with other conditions. There's lots of options available, and a penile implant could be a good solution, a good long-lasting and satisfying solution if you're interested. A bunch of references, I'll skip past that. Any questions?
Yeah, so we had a number of pre-submitted questions, Dr. Park. So the first one of those, a gentleman asked, said, I'm taking medication for my heart and have noticed that my erections aren't as strong. Could it be that the medicine is causing the decrease in?
One of the common medicines for heart, I'm assuming you're talking about like coronary artery disease, but one of the meds that they typically put you on is something called a beta blocker, metoprolol or atenolol. Those are famous for causing issues with sexual dysfunction. So it very well could be related to that, yes.
There's another question about somebody who's had a hernia surgery and wonders if they're still able to have a procedure done if they've had hernia mesh implanted.
Yes. So there are some people who will try to hide the reservoir where people have hernia repairs. One of the things I do is I place that reservoir in the middle of the body to avoid that. So if we're talking about a hernia, like an inguinal hernia or a sports hernia, then yes, I can still implant this without getting anywhere near that mesh.
Another gentleman asked a question about, so it's an advertisement for, was, believe this is an at-home or for your home use wave therapy device, and wants to know what your thoughts are on that.
I'm assuming you're talking about shockwave therapy. So you'll see a lot of advertisement for something called shockwave therapy. In urology, we're very familiar with shockwaves because we use those to break stones. And over the years, we keep seeing studies talking about how using shockwave therapy may be a way to stimulate blood supply into the penis. However, over the years, no study has really showed convincing evidence that it works well. And that's not to say that people aren't doing it and people aren't supplying the service. But if you look at the people doing this, most of them, you'll notice that most insurances will not cover it. And it's kind of a cash-based procedure. And part of the reason is that no company has really been able to definitively show that it's effective. And so people will still try it. Uh, Sexual dysfunction is a big business. You'll see all sorts of products out there being sold, lots of over-the-counter supplements. They kind of prey on people who are they're really desperate for a solution, and I think people are willing to try a whole lot of different things, especially if they don't know about the what good options there are. I would say look at the shockwave treatments with a grain of salt.
Thank you. Now we have a question. Gentleman has been taking tadalafil daily, stopped for a week, and then took 20 milligrams with no results. If tadalafil is not working, is Viagra an option, or is it worth trying another
Yeah,
kind of?
yeah, it's kind of like when people take cholesterol medications. You know, one may not work well, or you may have a reaction to one, but another related medicine, which is not the exact same, may work better. I usually will try at least one or the other, or if not both. Um, these days, you know, it used to be that insurances wouldn't cover. It used to be that insurances wouldn't cover the branded medications. It's very expensive. But these days, tadalafil and sildenafil are both generic. It's worthwhile to try, I think. Just because tadalafil isn't working like it used to doesn't mean that sildenafil won't. But if that doesn't work, then it may be time to talk about some of the other options.
Their maximum dosage for these medications?
Yes. So follow the directions carefully. We talked a little bit about the erection lasting more than 4 hours. So with tadalafil, there's two ways to take it. You can take a 5 milligram dose daily, or you can take the 10 or 20 milligram dose every 3 to 4 days. So when Cialis first came out, it was designed to be every 3 to 4 days because it stays in your system for 72 hours. The 5 milligram use came out originally because we found that it was helping guys with big prostates go to the bathroom better, and it also happened to improve sexual function in some people. But you don't want to go past 20 milligrams on the tadalafil. Sildenafil comes in up to 100 milligrams. 100 milligrams is the maximum dose, so you do not want to go beyond that. I've seen people who get to the maximum dose and they're like, well, more is better, and they keep trying it. You don't want to do that because if you're not careful, you're going to drop your blood pressure dangerously.
So, you got a question submitted. So, gentleman, sounds like he had a prostatectomy several years ago, and then 2 years ago did radiation therapy. And it's been over a year since finished treatment. Hasn't had an erection since. Is there any hope that he's going to be able to restore his natural erectile ability at this point?
If you're talking about natural ability, as in spontaneous erections without any assistance, I'm gonna guess no. Um, Between the surgery and the radiation, I don't know what your function was after surgery, but if it was compromised there, the radiation probably didn't help afterwards. So probably not spontaneous erections, but you can still get erections. It's just a matter of are you willing to try the injectable medications, the erectile or the vacuum erection device, or consider a prosthetic?
Now, for uh, patients who are seeing a primary care specialist, and this question came up, at what point do they see a urologist with erectile dysfunction, or when does that make sense?
It's up to it kind of depends on the primary care doc. Some primary care docs are okay helping with these kind of things. Others don't want to deal with it. They send you on pretty quickly. But if you're thinking you want to talk about the injections or the surgery, you can come talk to us. Your primary doc can help you with the oral medications just as well as any urologist. But once you start getting past that, most of them will probably send you on to talk to one of us.
Waiting for more questions to come in. As we do, Dr. Park, I know you get your number on the screen, but what's the best way to get a hold of you if a patient does want to see you?
If you're interested, just call the number, ask for Dr. Park, or if you say, hey, I'm interested in the prosthetic specifically. There's a couple of us who do them. Some of the other guys aren't doing them as much as they used to. So I've kind of taken over part of that practice. So if you just request me, you'll have a higher chance of probably getting to me if you say, hey, I'm interested in talking about the prosthetic.
Uh, How does somebody know if they are a candidate for that?
You come talk to us. We kind of have a checklist. We work with these insurances all the time, so we'll go through a big checklist of, are you a candidate, are you not? But we need to go through an interview, kind of see what your health history is, what kind of medical issues do you have, what medications are you on, a lot of different factors. But if you just come talk to us, we'll work you through that.
It looks like there's no further questions this time. So put that last call out there, and Dr. Park, if you have any final comments, please share them now.
Yeah, no, we're available. It's not something that people talk about, but we've got good options for you guys. If you think that you want to talk to us about any of these topics here, just you can talk to your primary doc and be like, hey, I'd like a referral, or some insurances don't require a referral. If you're interested in talking to us about these things, just let us know. Just give us a call. We'll be happy to help you guys out.
I did have a final question come in. So
Sure.
this individual said an arterial bypass and is a diabetic. Um, is it reasonable that any of these treatment options would be available to them?
Yeah, I usually, I guess if you're talking about if you had what we call a CABG or a bypass surgery for your heart, if you're not on blood thinners, then yeah, we could talk about the injectable therapy. We could try the oral medications. Between the vascular disease and the diabetes, it may not work. But if you're interested in talking about the prosthetic, I think you'd be a reasonable candidate for that as well, depending on what your other medical issues are, obviously.
So there's another question that came in. So individual had a procedure done for their BPH. Is it possible that this created a problem with their erections and their ability to ejaculate?
Yeah, I'm assuming we're talking about a treatment for an enlarged prostate.
Resume, I think, is what they.
Yeah, it can. Anything that affects the prostate. So the prostate kind of acts as a bit of a plug um, when you go to the bathroom or when you ejaculate. And sometimes when we do these types of procedures, it creates a channel that remains open in the bladder. And ejaculation is purely a physics thing. If there's an open pathway when you ejaculate, the fluid will just go to the path of least resistance. So Resume is known for not causing as high of a risk of that, but anytime you deal with the prostate and kind of take away tissue, you can do that. Anytime you mess around with the prostate with heat energy or electrical energy, the nerves are in that area. Well, we do a procedure called a transurethral resection of the prostate. Some guys call it a roto-rooter. People don't talk about it, but there is a risk of about 10 to 15% of patients will have sexual dysfunction after that procedure. So yeah, any prostate procedure that you have done could have a small risk on sexual dysfunction.
You. Looks like that's the last question here. So, Dr. Park, I really want to thank you for taking time out of your evening to be with us,
I'm
present, and
good.
share all
Thanks for
all
setting
the
it up.
and everyone for attending. Appreciate you taking time out of your evening to join
Very much for
us.
coming.
Dr. Park truly is a men's health specialist and really enjoys educating people. So, would recommend if you're having issues. He's a great person. He'll be in good hands. So, with that, I want to thank everyone again. And this concludes tonight's Men's Health webinar.
All right. Thank you, guys.
Good night.